Hi, everybody. Welcome back. We are going to now move on and hear from Amy Yachty, who is a board-certified clinical specialist in neurologic physical therapy and is a senior physical therapist at University of Iowa Healthcare. She practices full-time in outpatient physical therapy, working with patients that have neurologic impairments. Amy is on the staff of multiple interdisciplinary clinics at the University of Iowa, including the ALS Neuromuscular Clinic and the Myotonic Dystrophy Clinic. So, Amy, thanks for being here with us today. You can go ahead and start your video, and you can go ahead and present your presentation.
Can everybody hear me okay?
Yes, we can.
All right, great. Well, thank you so much for having me. I'm really excited to be here virtually today. As a physical therapist, I get asked a lot about what's the best type of exercise across different populations and with different diagnoses and impairments. So it's both, I think, probably the most common question I get asked and also one of the most challenging questions I get asked. And we'll get into why it's sometimes not a straightforward yes or no answer a little bit later today. So just some of the things that we will go over today that I hope by the end of the day that you have a good idea of the basis for how we decide what activities work well for exercise and what activities might not be the best approach, and where you can seek more information to find out what activities are right for you, because everybody is going to vary in what the right activity or exercise set is. So just a quick overview about limb girdle, some basic information here. It's mostly going to affect the muscles of the hips and the shoulders, though there are some variants that will see impairment in some of the more distal muscles, or the muscles that are further away from the center of the body. And then depending on the subtype, some people can have some lung or heart complications as well. It's a genetic disorder and it is progressive. And so that's one of the things that makes exercise sometimes challenging from a prescription standpoint. Some of the common challenges that people with limb girdle have are things like getting up out of a chair, things that use those quadricep muscles or the muscles of the knee and the hip. Sometimes we'll see challenges with going up and down stairs or curbs, especially a lot of times the curbs will be a lot bigger than a standard step. You might have a 9 or 10-inch curb to step up with nothing around you to help from a balance standpoint. We also sometimes will see changes to walking and changes with posture. And then challenges related to the arms or upper extremities, like trying to reach something overhead or getting the arms up overhead to do something like dressing or bathing. So overall, we know that exercise is beneficial for pretty much everybody. Some of the short-term benefits of exercise that can be gained after just one episode of exercise are improvements in sleep. It can decrease anxiety, and we can have a positive impact on blood pressure. With repeated bouts of exercise, from a long-term standpoint, you'll see improvements in bone health or bone strength. We can improve balance and coordination. And there's also some really exciting studies that are looking at how the brain can be changed by exercise. And there's some research out there that's showing a decrease in onset of dementia or cognitive impairment with regular exercise. And we also know and have known for a while that exercise can be protective against depression. There's also benefits for the heart, and we'll talk about that a little bit more specific to limb girdle in the next couple slides. There's also some challenges to exercise. You know, I think everybody probably knows exercise is beneficial, and if it was easy to do and accessible for everyone, we'd probably all be out there exercising as much as we could. Sometimes it's as simple as not finding the time in your day, having the motivation to do it, or maybe dealing with some fatigue. But I think a lot of time, especially when you have a neuromuscular disease or a muscle disease, knowing what to do, there's a lot of information and misinformation to try and filter through to figure out what should you do for exercise. And so sometimes it's just hard to get started if you're not really sure where to go. Fatigue is probably one of the biggest things that I think is a barrier to exercise for people. If you're dealing with fatigue, which about 60% of people with muscular dystrophy have fatigue that's rated as severe, it's going to be hard to think about adding something extra to your day because it might be a challenge to just get through the things that you have to get done, whether that's work, school, or just things that you need to do around the home and to take care of yourself on a daily basis. There's a couple different subtypes of fatigue. Some people just have an overall feeling of fatigue that's not really localized to one area, or you might have fatigue in specific muscles. I hear a lot from people about having fatigue in their legs when doing something like having to go up a flight of stairs. So we need to figure out how we can manage fatigue so that we can make exercise more of a regular part of our routine. And the good news is that the two can probably go hand in hand. So some strategies for fatigue management. The great news, there's a lot of research out there that looks at how regular exercise can be beneficial for fatigue. Now that means we have to approach exercise the right way. If you're dealing with a lot of fatigue, then going out and hitting the gym or taking a long walk might not be beneficial from a fatigue standpoint, is probably going to leave you pretty tired. If you can learn about different energy conservation techniques, which I'm going to plug my occupational therapy colleagues here because they have a whole host of resources they can help with, from figuring out how to conserve energy throughout the day to actually allow for more regular exercise and activity. Good sleep hygiene, so making sure that you're getting adequate and good quality sleep at night, can be huge on how you feel the next day. And often what you can tolerate from an exercise standpoint or how much fatigue you have is going to be variable. It's probably not the same every day. And part of that is going to be based on what you did the day before and also how well you slept that night. And then any other factors that you have going on in your life, including stress. The last thing that you can use from a fatigue management standpoint are mobility devices. And despite what my PowerPoint slide shows, I'm not talking about cell phones or laptops there. That would be more using something like a walker or a cane or any other type of assistive equipment that can help you throughout your day to leave a little bit more energy for other activities. So when we look at what we know about exercise specific to limb-girdle, we know that there's a lot of benefits for the general population, but we know that limb-girdle is going to affect muscles. And so how exercise is going to work on those muscles is going to be a little bit different from the general population. We know that exercise can prevent disuse atrophy. And disuse atrophy is just a medical term that says if you're sedentary and you don't use your muscles, that you're going to lose some of your muscle strength. So this goes back to that use it or lose it mentality. So we know that if you do nothing, you'll continue to get weaker. We know from some studies on slowly progressive forms of myopathy or muscular dystrophy that low to moderate intensity strength training and aerobic training can be beneficial. And we know that if we can improve aerobic capacity through aerobic exercise, that we can decrease the different diseases that are related to a more sedentary lifestyle. And that would be things like obesity, hypertension, or type 2 diabetes. But we also need to look at if there's any risk associated with exercise for people with limb-girdle muscular dystrophy. So that's what we'll look at next. So you can't have too much of a good thing. We know that we talked about if we do nothing, we're going to get disuse atrophy and those muscles will get weak. But if we overwork muscles to the point of extreme fatigue and exhaustion over and over, we also can cause damage to the muscles and actually accelerate muscle breakdown. So it's really important that with any activity or exercise that you monitor for signs of overuse. So that would be if you do an activity, you know, it's reasonable after an exercise session or even a physical therapy session that you go home and you need to rest for, 20 to 30 minutes. I think that's pretty reasonable. But if you're taking an hour and a half to recover, or you're having increased weakness after the activity, or you can't complete your typical activities due to fatigue or cramping or pain related to that exercise or activity, that's a sign that it's too much and you need to modify. So I put that plug in there that this could be related to physical therapy, because depending on what you're doing in physical therapy and what your physical therapist's comfort level is in working with people with limb-girdle, you need to be the expert on the topic and give them that feedback. If you're doing activities that you're exhausted by that take the rest of the day or into the next day to recover, please give your physical therapist or your occupational therapist that feedback so they can help modify the treatment plan to make it more beneficial for you. So ultimately, this slide is probably the most important slide of what we'll talk about today. Our goal with exercise is to balance underwork and overwork. So we talked about if we're sedentary and we don't work our muscles, we're going to have disuse atrophy. Those muscles will weaken. Along with those weakening muscles, then we're going to have more trouble doing our daily activities, getting out of a chair, getting out of bed, going upstairs, walking. We also are probably going to have an increase in fatigue because we lose some of the aerobic capacity in our body to do activity. And then also, the weaker we get, the more challenging those daily activities become. So it gets a lot harder to just get up out of the chair and do the things you need to do. I think there's also a psychological impact associated with having that sedentary lifestyle and maybe not being able to get out and move as much as you'd like to. The flip side of that is if we overwork our muscles and we continue to push our bodies to the point of extreme fatigue and we ignore those signs of overwork, then we can accelerate the progression of the muscle disease and cause more weakness, more pain, and lose strength more quickly. So really our ultimate goal is trying to balance out these two sides of the scale. And that's why whether exercise is beneficial or not it's not a yes or no question. It's not a yes or no answer. Some exercise is, but what that exercise type would be and what the intensity is going to be really variable depending on a lot of factors. So anytime you're taking on a new activity or considering starting a new program, and keep in mind that an activity, depending on what your current fitness level is, it doesn't necessarily mean that you're going to the gym. You know, walking outside or going to multiple stores or spending the day walking through a mall, that can be a lot of activity if it's not something that you're used to doing. So we need to think about the activities we're doing and how we can balance work and rest to keep this scale pretty level here. So there's four main types of exercise, or four categories that we're going to talk about. So aerobic exercise, strength training, flexibility and range of motion, and balance. And it's important that we kind of hit all of these categories when we're looking at what our physical activity or exercise program looks like. They each have their own benefits, and they each are going to have some different activities that you can do to really focus on them. So aerobic exercise, what we'll talk about first. An example of this would be swimming, walking, riding a bicycle, whether that's outside or a stationary bike. And the definition of aerobic exercise, or what we commonly refer to as cardio, is using large muscle groups in a continuous and rhythmical way. And so the aerobic exercise is going to work probably multiple parts of your body at the same time. If you think about walking, the obvious thing that we're working is our legs, but you're also working your arms and your core a little bit when you're moving your arms. Same with riding a bicycle, you're having to balance and use some core muscles to stabilize yourself. And then swimming is definitely using a lot of different muscle groups. So one way to monitor how the aerobic exercise intensity is going for you is using the talk test. So there's been some research that looks at monitoring heart rate and exercise intensity and how well you can talk or speak while you're exercising. So if you've ever gotten really out of breath, running down the street or jogging up a flight of stairs, it's hard at that point to speak in a full sentence. You can maybe get a couple words out. And so we want to use this talk test that would show that whatever activity you're engaging in for aerobic exercise, you should be able to talk in pretty close to full sentences. So that's going to keep you in that moderate range of activity, which is where a lot of the research that's been done with muscular dystrophies points to having a beneficial effect. So a way that you could tell if you were in low intensity would be singing, and high intensity exercise from an aerobic standpoint would be only being able to get out a couple words at a time. Whatever activity you're going to choose to do, and this applies to aerobic and strength and balance and flexibility activities, is safety needs to be kept in mind first. So if you haven't ridden a bike in a couple years, don't go out and get on a bike in high traffic areas alone. You're going to want to make sure that you're doing things safely and keeping in mind any risk for falls or trouble with balance that you have. So some more options to consider: walking outside. Exercise classes can be great if you're someone that likes that social involvement to your activity, But I think it's always important to have a conversation with the instructor of the class and maybe let them know what your current level of activity and exercise is, and maybe some of the things that you're working towards. That way, they may be meaning well with their encouragement to increase weight or increase the intensity, but it's good for them to know that you're going to keep it in that moderate range because that's what's best for you and your body. Strength training is the next category that we'll talk about. So this is training to improve muscle strength and muscle endurance. So I think about those as two different things. So muscle strength might be, you know, if you've been examined by neurology or physical therapy before, where they have you lift your leg up or lift your arm up and see how hard they can push down to test that strength. That's kind of looking at a 1 repetition, that power you can generate and that muscle strength. To me, muscle endurance is more, if I've got to go up 12 stairs, a flight of stairs, that might not be a maximal contraction for my legs, but can it tolerate doing that 12 times without getting overly fatigued? So strength training is looking at both of those things. So it's defined as repeated contractions against resistance, and resistance can be pretty much anything. I think traditionally we think of lifting weights or dumbbells or maybe using resistance bands, but something important to consider is, depending on the level of weakness that might be present in a muscle, sometimes just the resistance of gravity on moving a muscle part can be enough resistance. It's important that we're not using heavy weights in muscles that we can't freely move against gravity. So there's less research available on strength training than on aerobic training. And I think strength training is something that's going to be a little bit more variable for each individual person, just because the onset of muscle weakness is going to be so variable. It's really important to be closely supervised or monitored initially. I think that when taking on a new exercise program, this is a great time to get involved with your physical therapist, and we'll talk a little bit about that later today. Like I mentioned on the last slide, if there's a muscle that you can't move against gravity, so if I can't lift my arm all the way above my head against gravity, then I'm not going to put a weight in my arm and try and move it repeatedly with a weight, because that could easily overwork the muscle. And then we always want to work muscle groups on non-consecutive days. So not working out the same muscle group every day, but giving muscle groups at least 1 day off, if not 2, to recover prior to working that muscle group again. So some options to consider: resistance bands are great, moving against gravity, or just moving with body weight. One of my favorite exercises for people is doing repeated sit to stands. And sometimes I'll have people start on a higher surface, like on a bed or on a bar stool that's a little bit taller, so that you can work on building that strength up, but maybe it's not as intense for your muscles as trying to get up off of a low sofa or a low chair. And then again, with strength training, you're going to really want to monitor closely for those signs of overuse. You're more likely to have overuse issues with strength training than with the other 3 types of exercise. So that's why it's so important. And again, why that close supervision is really important. And even if you're working with a physical therapist on coming up with an exercise program, you still are going to be the best judge of your fatigue and pain level and monitoring how you feel on a daily basis. If you have an off day, you're having more fatigue, maybe you didn't sleep well, it might be a good day to either do less repetitions or take the day off, or decrease the resistance if you're using resistance. Flexibility and range of motion, I think, get overlooked a lot. I don't think they are talked about as much when we talk about exercise, but to me, they're one of the most important things to work on. When we have muscle weakness, there can be a loss of range of motion or flexibility at joints, and that can really impact function. So something we'll talk about today is foot drop, which is what happens when we have tightness in the ankle muscle as a result of weakness in a different set of ankle muscles. If we use gentle stretching, we can help maintain range of motion and even get some range of motion back that maybe has been lost due to weakness or just due to not using that group of muscles. I think it's great to initiate these exercises early. Typically, even if I'm not seeing tightness in muscles, I'll have people start working on a flexibility program just to get it to be part of your day and part of your routine. Because ultimately, the more flexible a joint is, the easier it is to move it. It's going to take less strength to move a joint that's not tight. And if it takes less strength, it takes less effort. So when we think about something like walking that we might be doing thousands of steps a day, anything we can do to improve the efficiency of that is going to have a beneficial impact on fatigue. So with flexibility, we're gonna hold stretches for 20 to 30 seconds. That's really important. I think back to doing PE classes when I was younger, and we'd kind of bounce in and out of stretches. And knowing what I know now, I wanna go back and tell everybody to slow down and hold their stretches. Because if we just move into and out of a stretch, we're not giving that tissue that we're trying to stretch enough time to actually change. So if you think about holding a rubber band, if I pull my rubber band and let it snap back, the rubber band's the same size. If I take that rubber band, I pull it out and I hold it for about 30 seconds, then when I release that pressure, that rubber band is a little bit bigger than I started with. So that's what you want to think about when you're stretching your muscles. Depending on what your functional level is, you might need some help to stretch certain muscles. Calf muscles, which are one of the things that get tight very quickly, are also really strong muscles. They're meant to lift our body against gravity every time we take a step. So it can be hard if you're not able to stand and balance to stretch that without assistance. Other places that are sometimes hard to stretch without help are the back of the knees or the hamstring muscles. And then we can also utilize braces or splints to get a longer term stretch. A lot of times we'll prescribe splints to be used overnight to help stretch things out, like the wrist muscles or the ankle muscles. It's just a nice way to get a lower intensity stretch that can be held for a longer time because it's being done passively with the use of that splint or brace. It's important to know that having a sensation of the muscle stretching is totally fine, but you never want to stretch to the point of pain or discomfort. So while we want to hold that position for 20 to 30 seconds, there's no need to get to the point of pain. Balance training is the last category of exercise, and I think also gets overlooked along with flexibility. Our balance is controlled by 3 different systems: our vision, our inner ear system, and then the feeling in our feet and our other joints. And so it's important that if you're noticing some troubles with your balance, you get evaluated by a physical therapist who can look at how each of those systems is functioning and figure out which one might need to be worked on, or maybe they all need a little bit of work. Some of the things that can happen, such as weakness or tight muscles or stiff joints, can negatively impact our balance. And so because those things commonly happen with limb girdle, it's important that we're addressing balance early on. Balance can improve, just like if we work on our aerobic capacity, that can improve. Balance can improve, but it needs to be specific to balance, and it needs to be something that's based on what your individual needs are. So none of these exercise types are a one-size-fits-all approach, but I'm going to say that balance, even more so, it needs to be individualized. So when we think about exercise, I think these are some of the common things that we think of. You know, a gym is probably the most common thing that pops into people's heads, and that's not the right thing for everybody. Group exercise classes can be great from a motivation standpoint, but not everybody wants to work out with a bunch of people. And I think what we need to consider is that exercise can look like a lot of different things. We have those 4 categories of activity and exercise, but a lot of things you can find are going to incorporate components from each of those. So if you think about gardening, you're absolutely getting some aerobic capacity. You're working on that balance and range of motion and coordination and strength, just getting down to plant something and stand back up, or having to walk while you're carrying something or reaching. And that same thing can be said about dancing, playing, which I think is completely overrated. I think oftentimes we think about playing as something that's just for kids, but playing in all different forms can incorporate a lot of really great exercise. And then my least favorite is cleaning. Now, the good news is most of us have to do this in some part. So that helps. When we talked earlier about how time can be a barrier to exercise, there are ways that we can use exercise and gain benefits from things that we already maybe need to do. So the big question that I get multiple times a week is, what is the best type of exercise? A lot of people just tell me what I need to do and I'll do it. So the best type of exercise, there's not one thing. It needs to be enjoyable, safe, and accessible. I think there's a lot of information out there about how great swimming or water aerobics can be for people, but not everybody has access to a pool. And then something that I think gets overlooked is it's a lot of energy to get to somewhere with a pool, walk in, change clothes, get in the pool, do your activity in the pool, get out, change clothes, shower, and get home. And so if exercise is easily accessible and you enjoy it and it doesn't wear you out to do all those other steps, that's a great exercise. But it doesn't mean it's a great exercise for everybody if it doesn't meet all of those criteria. So getting started with exercise, I think it's always important to talk with your medical team. If you're involved in an interdisciplinary clinic, that's a great time that you can talk with your therapy team as well as your medical team to see if they have any other things that need to be monitored, whether from a cardiovascular standpoint or a breathing standpoint. It's also good for them to know that you're changing what you're doing so they can help monitor and progress if needed along the way or help you problem solve through it. The American Academy of Neurology does recommend that people with limb-girdle are referred to an interdisciplinary clinic. And if you're not familiar with that setup, typically you're going to be seeing at least one physician. Sometimes there's multiple physicians involved, as well as physical therapy, occupational therapy, sometimes speech therapy, sometimes cardiac and pulmonary testing. One of my favorite things about my interdisciplinary clinics is when we're not in the middle of a pandemic, we're able to have the MDA present and they have their representatives there that can, after we go in and talk with the patients, come in and share resources. And it just feels like there's a lot of value that we can give during these clinic visits because we're all working together. So there's no one size fits all program. So this is why I can't just give you, I'd love to give everybody a recipe and say, this is the right exercise for you to perform. Don't do this, definitely do this, and do this many repetitions. But for the reasons that we've talked about, that's not possible. It's really going to be variable. And the best place to start is with an examination from a physical therapist. And then you should consider incorporating all of those different categories of exercise into your routine. Everything should be submaximal. So if you have the mentality of no pain, no gain, then you need to erase that from your mentality and think about how you can incorporate activities without pushing yourself to the point of exhaustion. And then stopping before you need to. Some people, they start exercising and it just feels great and you get this endorphin rush going and then it gets easy to overdo it. And the problem with that is then oftentimes we're going to have increased fatigue, increased soreness after. And so we get excited, we do a lot of exercise, then we're really fatigued and painful. And so we do nothing for a couple days. And then that motivation comes back and we do a lot. And then we go back to doing nothing. And so we want to avoid these peaks and valleys of activity and just try and stay pretty stable with what we're doing while listening to your body and respecting what it needs. It's important to frequently reassess what you're doing to see if it's still safe and appropriate. And again, that can be on a day-to-day basis, depending on how you're feeling that day. A lot of times you're going to be the expert on limb-girdle if you're going to meet with a new physical therapist or sometimes even a new physician that's maybe not part of your interdisciplinary care team. So it's important to educate those people. If they make a recommendation to you that doesn't seem to be in line with what you've learned previously, there's a lot of resources out there that you can share. But I encourage people to be the expert on themselves and be okay with advocating for yourself based on what you know. If you're here watching this program, then you're clearly interested in being educated and advocating for yourself. So use that information, even if it seems like it's somebody that maybe knows and has a medical background. Prior exercise status might be a factor. If you've been a lifetime exerciser, then you probably have a little bit more capacity going into exercise versus somebody that has maybe not been as active throughout their life. But just because you haven't been a lifelong exerciser doesn't mean that we can't get started now. We just need to monitor closely, just like we do for everybody. And then find something you enjoy doing. It doesn't matter if we could find a magical exercise that would fix everything, because if you don't enjoy doing it, you're not going to make it part of your routine, and it's going to be hard to carry out on a regular basis. And then if you're exercising on your own, like going for a walk outside, or you're going to be in an isolated area, it's always good to let somebody know what your plans are in case you have some trouble while you're doing it. So I'm going to touch briefly on physical therapy for limb-girdle because I'm a physical therapist, so I'm biased, but I think that there's a lot of really important things that you can learn by working with a physical therapist. So overall, the goals of physical therapy are to improve your function. One of my favorite things is talking with people about what are you not doing right now that you want to be doing, or what's not working as well as you want it to, or what do you want to keep being able to do. We might need to modify what you're doing right now. Might not look the same as it did 5 years ago, and might not look the same in 5 years in the future, but usually we can find some ways to work together to keep you active and engaged in the things you enjoy doing. A big part of what we do is looking at risk for falls and determining if there's anything that needs to be done to help decrease that risk for falls or manage it. We can prescribe adaptive equipment or devices, and then exercise prescription. So helping you start a new program or monitor your current program, or problem solve through any difficulties you're having with exercise. So one thing that I see commonly is foot drop. And so this can happen when there's some more distal involvement with the muscular dystrophy. And so if we look at an ankle, the ankle has two ways of movement. One is going to be up, and so we call that dorsiflexion. So that's when the foot's lifting up above the neutral, and the other is plantar flexion, when your toes are pointing down. Typically, the reason foot drop happens is because we get weakness in the dorsiflexors. They're this tiny little muscle that runs up the front of your ankle. And your plantar flexors are this huge muscle that's your calf muscle. You actually have two of them, and they're really big, strong muscles meant to lift you up off the ground every step. So our plantar flexors tend to get tight, and when they're tight, they pull the toes down in a plantar flexion, and our dorsiflexors get weak, which makes it hard to lift the toes up. So what we see with foot drop is the foot will drag or the toe will catch when walking. So sometimes people will feel that toe catch or toe drag, and they'll compensate by lifting that leg up a little higher, which we call a steppage gait. And that's going to help keep the toes from catching, but it increases energy expenditure a lot, especially because with limb girdle, those muscles around the hips tend to be weak. So if you're having to use those muscles extra every step, it's going to make walking a lot less efficient, and you're going to be at increased risk for falls. So one of the things we have to figure out if people are having trouble with foot drop is, do we use a brace or do we not use a brace? Just like exercise, there's no one size fits all answer to this question. And so it depends on what the patient's preference and goals and typical activities are. Most braces need to be worn with shoes. So if somebody's having a lot of trouble walking in their home, but they don't wear shoes, then a brace might not be a helpful solution. We also see that the brace can help with ankle stability, but it's going to change the way the knee's functioning as well. And sometimes that's a beneficial change, and sometimes it's not as beneficial. Depending on the type of brace, there can be some added weight. And so looking at the different types of braces and how putting a brace on is going to change the walking pattern, we need to make sure that we're doing more good than doing more harm. And then also, dragging the foot or catching the toes is not always due to ankle weakness. So if the foot drop or the ankle drag is caused by higher up in the body, like at the hip, then we can put a brace on, but it's not going to actually solve anything. So this is an example of a carbon fiber ankle foot orthosis, or AFO. This is a type of brace that I really like if I'm looking at bracing somebody for foot drop. And primarily the reason I like it is it's really lightweight, so about 7 ounces, less than half a pound. And so it can help pick the toes up and keep them from dragging. They're typically pre-made or off the shelf, so they just have to be trimmed to fit. And we can usually get a trial piece of these so that you can wear it in clinic and see if it's going to help before we go through the process of getting one for you. So I like being able to try it in real life and see if it's going to help, so that we're not prescribing equipment that maybe is just going to sit on your shelf later. A trekking pole or a single tip cane is another piece of equipment that can be beneficial. So things to think about when we're looking at adaptive equipment is what the upper extremity strength is. Is the arm having enough strength and coordination to use something like this? And what the level of balance impairment is. The cane or a trekking pole can be helpful if you're just having a little bit of trouble or maybe just trouble on uneven surfaces, but some people are going to need more than this. And then a four-wheel walker or a rollator walker, these are kind of the Cadillac walkers here. They can be helpful because they give support through both arms. And then the biggest thing that I like about them is there's a seat. So for somebody who wants to maybe take up walking for exercise, but they worry about fatigue, it can be nice to walk with a walker so that when you get tired, you turn around and sit and recover a little bit before finishing your walk. Okay, so that's all I've got. That was kind of a quick overview of physical therapy. And again, not all of those recommendations are going to be the right thing for everybody, but just some of the more common ones out there. So I'll go ahead and take some questions now.
Thanks, Amy. We've got quite a few questions in. Okay, concerning leg bracing, is there a good way to figure out what is best to use versus instead of doing, just a trial and error? Is there something that would work for weak feet?
Yeah, so unfortunately, trial and error tends to be the most common approach. But by trial and error, I mean, you should be able to work with a physical therapist or an orthotist to try things on a short-term basis before you're having to go through the process of maybe purchasing out of pocket or through insurance. So I would just encourage finding a physical therapist that is maybe well-versed in different options for braces and things that are out there, so that they can at least start with a better idea of what might work for you based on your strength and range of motion impairments.
Okay, that sounds good. What advice do you have for folks, for example, pool therapy? Insurance only covers so many visits for that. Is there a workaround that they could work with their physical therapist about prescribing pool therapy, or is there any way you can work around insurance with something like that?
Yeah, so insurance is probably a big challenge for physical therapy in a lot of different ways. I think it's important to know that physical therapy is never going to be something that's a continuous thing forever. We typically look at physical therapy more on like an episodic basis, but that doesn't mean that you need to wait until you're having a big problem to go back to physical therapy. A lot of times with pool therapy, I think a great plan is if you can work with your physical therapist a couple times to figure out what's the right routine for you, and then finding a way to transition to an independent pool program. And that's going to vary based on your area. The hospital I'm at, we're fortunate that we have a pool that we can do aquatic therapy and then have people transition to coming in on their own. And then we can kind of touch back into physical therapy if needed to monitor things. But there's not really a big workaround. And in my experience, it's not really specific to whether that's pool therapy or land therapy. It's just, in general, therapy is going to be more of an episodic plan of care rather than continuous forever.
And then take those plans home or to their own.
Yeah. And that should be one of the big goals that you're working on in physical therapy. And, I think that we start thinking about what's after physical therapy, even at the first visit. Even if I plan on seeing you for a couple months, always in the back of my mind is, what are we going to do so that you can keep being successful after physical therapy ends? And sometimes it can be helpful to change the frequency. So maybe you'll start off going to therapy twice a week for a couple weeks and then tapering down. And then often I'll have somebody come back maybe in 4 to 6 weeks as we're getting towards the end. I think it helps knowing that you have that check-in visit coming. I know I'm a lot more accountable for things if I know that I'm going to be meeting with someone to talk about it in 4 or 6 weeks.
Me too.
So it can be really helpful knowing, I'm going back to see PT in 4 weeks. I better make sure that I'm doing these things. And then it can also help that maybe if something's changed in those 4 or 6 weeks, maybe it's time to start increasing frequency again, or maybe you're doing great and really successful and we can look at discharge.
Okay. For someone who wants to incorporate walking in the routine, but it seems difficult to walk even after a few minutes, is there some type of machine or exercise equipment that you might recommend for that?
Yeah, so I'll tell you that one of my favorite pieces of equipment, if we're talking about workout equipment, is a New Step machine.
Is the
And I
what?
should a New Step, NUSTEP.
Okay,
Um,
I'll type that
it's a
in.
recumbent stepper. So you sit and you're using your arms and your legs, and you're using them in the same reciprocal pattern or alternating pattern that you do when you're walking. And so I think as far as exercise equipment goes, like something if you're going to go to a therapy center or a YMCA or a gym and work out, the New Step is probably my favorite. What I like is that you're sitting down, so there's no risk for falls, and you
Hmm.
can use your arms and your legs, and you're using them in the same pattern that you would walking. But another thing to
Exactly.
consider if you really enjoy walking is could you do something like use a walker so that you could maybe walk a couple minutes and sit and
Sit
rest
and
and then
rest.
get up
Yep.
and go again. So, and then also just seeing if there's anything from a breathing standpoint, if your trouble is with breathing, that might be a good thing to meet with pulmonology or your lung doctor and see if there's anything from their standpoint that needs to be modified.
Okay, that's a good point. This person's using a leg press in physical therapy,
Sure.
and they've been using it for a while, but they want to make sure that they're not making their progression worse by
Yeah.
using that, so often.
Yeah, yeah. So again, I think it depends on. I use a leg press a lot. I think it just depends on how you're feeling after you do it. So
Okay.
typically, I'll keep the resistance on the low to moderate side, and it might be 10 to 12 repetitions. We're not going to do 8 repetitions at the heaviest thing you can do. And we're not trying to work to that point of muscle fatigue. So you're not trying to get to the point where you can barely push it anymore. I would say if you're feeling that significant fatigue where you can barely get that last repetition done, then that would maybe be a time to modify. So decrease the repetitions, decrease the resistance level. But I don't think that the leg press in general is a bad idea. We just need to
Okay.
monitor how we feel after.
Okay. Take a test of how you feel afterwards.
Yeah,
This
exactly.
this person texted in or put in the chat that Planet Fitness has one of those new step machines that you talked
Yeah, yeah. A lot of times I'll just have people call around. I kind of know in my
about.
area what places have them, but I really like them.
Is there a difference between the new step and a recumbent stationary bike?
There is. So the
Okay.
new step, the on a stationary bike, your feet are still going around like on a bicycle pedal, and
Yeah.
on the new step, they're going back and forth like this.
Oh, okay.
So a lot of times people who maybe get knee pain on a bicycle
Mm-hmm.
tolerate the new step better because you're not getting as
Interesting.
much knee and hip bend or flexion as you would on a bicycle.
Okay. That's interesting. Um, if you are, you can't really get out of a chair very
Yeah,
much, or you have difficulty doing that and you have very limited walking,
yeah.
um, is there aerobic exercise that you could use when you're strapped into the chair or that you could strap to your body? Is the new step something that you could do that?
So the new step is pretty hard to do from a seated position. I have had people have luck if they have access to either a little pedaler that sits on the floor in front of their chair,
Oh, okay.
or you can sometimes pull a chair up behind a recumbent bike and put your feet on it and pedal. But other things you can do to get exercise from a seated position would just be moving, though. If you can kick your legs out against gravity, if you can
Okay.
march your legs, if you can do some, bending of your elbows or reaching overhead, anything like that is still going to get you some aerobic benefit.
What
It
about
doesn't
resistance?
necessarily have to be a piece of equipment to do that.
Okay, that's true. Resistance bands too, I guess they could use.
Sure. Yeah. Yeah.
Okay. Are there any recommended stretches for ankle tightness before or after walking
Yeah.
or just general physical therapy?
Yeah, so I would say my favorite ankle stretch is standing up against a wall if you're able to do that safely, or a counter, and leaning forward with one foot back to stretch
Oh,
the
okay.
muscle. I think it's kind of the calf stretch that everybody thinks about when they think of a calf stretch, because you probably did it in PE as a kid or
Yeah,
at some point
exactly.
in your life. And most of us have done it before. It's just a matter of making sure that you're holding it for 30 seconds so that you're truly getting the benefit of the stretch.
Hmm. This person says that they like that the walking movement would be good if they do an activity like golf. Would golf be harmful if there's no discomfort or pain associated with that?
Nope. Nope. And golf is a great example of one of those activities that's going to give you some aerobic activity, some strength, some coordination, and some balance. So that's a fantastic way to get some exercise.
Mm-hmm.
Again, it just monitor for those signs of overuse and how you feel after.
Okay. And you might need to pull it up. I don't know. This we have a person that's asking, what is the AFO brace called that you showed? We have an AFO brace, but it didn't look like the one you had talked about. Do you
Yeah,
remember what you
I
showed?
think I'm going to go back a couple
Okay, yeah,
slides.
that'd be great.
So the one in the top corner, so these are two different versions. One is called a posterior leaf carbon fiber AFO. So that's the one in the top. And
Okay.
this specific one is made by Ottobock, Ottobock. And this is their reaction AFO. And I really, the whether you do a posterior leaf like that one or the anterior leaf like the one on the bottom is just going to depend on kind of how the rest of your leg works. I like to put people in both and let them try and see what feels better.
Mm-hmm.
But the overall name would be a carbon fiber AFO. And so those are going to be substantially more lightweight. The ones that we typically see other than this would be more of a custom AFO where they're made out of typically white or clear polypropylene. Sometimes they have fun patterns, but they tend to be a lot more full coverage at the ankle. And that can be beneficial if you have ankle instability. But a lot of times what I find is even though it might make the ankle more stable, because they're so much heavier, they're usually 2 to 3 times heavier than the carbon fiber AFOs, that it just takes so much energy to use that any benefit from the increased stability we lose from the decrease in efficiency with walking.
Okay. Those are very slim looking.
They are.
I've never seen one of those either.
Yeah.
Okay. A couple more questions. What do you think the best option is to help with stairs? Is there a way you recommend going up or down a set of stairs?
So there's some
Safely.
problems. Yeah. So stairs are really hard. Sometimes people have better luck going sideways, so they can put both hands on the rail and going up or down sideways. I have some people that feel more comfortable going down backwards, but I only recommend that if it's on a short flight of stairs, like maybe 3 to 4 stairs on a split level home. It would make me pretty nervous to do a full flight backwards just because you can't see. Going one step at a time. So bringing both feet up and then coming to the next step. Leading, if you have a stronger side, you're going to lead with your stronger side going up. And then going downstairs, you're going to actually lead with your less strong side. That way, if I step down with my weaker leg first, it's my strong leg that's going to lower my body weight down with control to the next step below.
Okay.
Those would be some different strategies to try.
Those are some good options.
Nicole, there was one question I saw in there that was asking about dealing with insurance and physical therapy when things aren't necessarily improving.
Yeah.
And I did want to address that one because I think that's a really important thing. So I think it's a very common misconception that physical therapy needs to be that we need to document changes in strength and improvements in strength. There was actually a big Supreme Court case a couple years ago that insurance can't deny because of lack of improvement. So this is where making sure that you have a physical therapist that kind of understands how to document these things well can be really important. So again, this doesn't mean physical therapy can go on and on and on forever continuously, but I am absolutely opposed to the idea that if you're not improving, then we're not doing something beneficial. And there's lots of resources out there through the American Physical Therapy Association, mostly related to Medicare, because Medicare tends to be the one that people previously would say that you had to show improvement. But if we can show that we're helping either slow decline or improve safety, there's a whole subset of therapy called skilled maintenance therapy. What that means, if I'm seeing somebody and we're at the point where we're not necessarily going to make things better, but I think with my clinical judgment that therapy is going to prevent things from getting worse, I can document that I'm doing skilled maintenance therapy. And so I still have to justify the medical necessity, just like I do with any physical therapy, but it's absolutely false that you have to be showing changes in strength or improvements in strength for therapy to continue. So I would urge you, if you're being told that, to educate yourself on some of the resources out there on skilled maintenance therapy, and then have that discussion with your therapist. Again, it doesn't mean they're going to see you forever, but it doesn't mean that you have to be getting stronger for therapy to continue happening. Sorry, I just
Okay.
want to make sure we address that one, but
No, yeah. And I wanted to ask too, you said the National Association of Physical Therapists?
American Physical Therapy Association, the APTA.
So is that an organization that folks could reach out to find someone who might be focusing their PT on limb girdle or neurological issues at least?
You can definitely search to find somebody that's maybe a board certified neurologic physical therapist. And I think that's a great place to start. They might not necessarily specialize in limb girdle, but they're going to have more knowledge of just how neurologic processes work than someone else. And I think a lot of it, you just have to call around places, talk to people, and you'll kind of get a feeling working with someone if they have a good grasp on what your diagnosis is. If you are involved in a clinic, a lot of times from a clinic standpoint, we develop a network of therapists in outlying areas that maybe we know we've had good experiences with patients with. And then we're always happy to reach out. If you're seeing a therapist local to you, we'll have them give our information to their local therapist. So if there's questions, we can help problem solve from afar. We're unique in that a lot of our patients travel 2 or 3 hours to get to us and then go back home. So if not, then maybe you're close to your clinic and you can just work with your clinic therapist regularly, which would be great.
That's a good suggestion. Can using braces be detrimental and atrophy muscles?
Oh, that's a great question. And there's some fresh research out that is not the case.
Okay.
So you're not going to make yourself weaker using a brace.
Okay.
Especially a brace like these carbon fiber braces, they're not going to stop you from using your muscles. They're just going to limit how much that foot drops. You can still use those weak muscles to lift your toes up with the brace. When we would see weakness is if we put you in a cast where you can't move your leg at all. But they've done studies where even using a really full contact, heavy duty AFO, they can put electrodes on the muscles and see that even in those more restrictive AFOs, the muscles are still firing, the nerves are still firing. So no, I don't believe that using AFOs makes you weaker. And I would say the second part of that question is a lot of people feel that if they start using a walker, they'll become dependent on it. And the way I feel about it is it's not that you're becoming dependent on it. You're just getting the stability that your body has been looking for. So you got to think about braces and assistive devices as being tools so that you can do more and do the things you want to do. They're the tools that help you get back to where you were, not necessarily things that are going to limit you or make you weaker or make you reliant on them.
Okay, that's good. That's good. Do you have an opinion on a medial strut or a lateral strut AFO? Do you have any comments?
Yeah, it really depends on your specific anatomy. Some people will get skin breakdown from one more versus the other, and that tends to do with more what your foot from a side to side standpoint looks like, or if you have some weakness there. So I would say whatever is going to be more comfortable for you, because these carbon fiber braces, carbon fiber is incredibly lightweight and incredibly strong. So if it's rubbing on any part of you, the carbon fiber is going to win. Your skin is not going to hold up to the carbon fiber. So it's important to try. And if you find that the medial strut or the strut on the inside is rubbing somewhere, then try one with the strut on the outside and see if that's more comfortable for you. I have seen both posterior leaf and anterior leaf AFOs. So the ones in the front and the back, you can usually find a version with both an inside or medial strut and an outside strut. So you just have to look across different manufacturers and brands.
Okay. Okay. Do you have any suggestions on knee braces for stability and walking?
Yeah. So a lot of times I'd say if you're having instability at the knee, I would be curious to have you try an ankle brace, because if you look at how this strut goes up the back of the leg there, that's going to give you some stability during stance. So when that weight is shifted onto your leg and your knee maybe wobbles and feels like it's going to buckle, that strut there can help control that knee buckle a little bit. Most of the time, braces at the knee are not going to be, it's not a long enough lever arm to actually change what's happening at the knee joint from a forward backward standpoint. It
Mhm.
might give you a little stability if you maybe have some side to side weakness or some osteoarthritis causing a little bit of side to side movement. But from a knee stability standpoint, I would try something like the carbon fiber ankle brace and see what that does for the knee.
Okay, interesting. Can gripping a walker contribute to our arthritis?
I don't know that there's any studies out there that would support that. A
Okay.
lot of times using the walker, you don't need to grip it really hard. I would think about pushing a shopping cart in the grocery store. So you
Okay.
can just rest your hands on it. Even the
Yeah,
ones with the brakes, most of the time you're not squeezing the brakes all the time. So
true.
while I can't point to any specific research on that, that would be pretty low on my list of concerns.
Okay. And is a massage something that is safe to do for post-workout recovery? Is that something that you would recommend?
Yeah, so I think that if massage feels good, I don't think
Mhm.
it's going to hurt anything. If you're having to get a massage because you're so fatigued or painful
Yeah.
from your therapy session, then I would kind of wonder if you're overdoing it. But if
Okay.
you want to get a massage and it feels good, I don't have any concerns with that.
Okay. And I just want to be mindful of our time, but I just kind
Yep.
of wanted to touch base. Someone had typed in, and I think this is kind of pertinent. Could you explain what skill maintenance therapy is?
Yeah. So skilled maintenance therapy is when you are maybe not seeing an improvement in function
Hmm.
from, when you go to physical therapy, they're going to do some testing on the first day, maybe looking at your walking speed. If you walk, looking at how well you get out of a chair. Often we'll test muscle strength, but because muscle strength is probably not a great indicator of function, we don't worry too much about that. But if I think we get to the point where we're maybe not going to see improvements in those items, but we know that you're maybe still having trouble with falls or still having trouble with balance, or we're trying to figure out what the best exercise routine is for you, I can document in my notes to insurance that we're switching to skilled maintenance. So my goal is no
Okay.
longer making improvements, but I can list out what the medical necessity is. So maybe that's slowing decline or managing fall risk. A lot of times it's slowing decline is what I personally use for my justification for skilled maintenance. So
Okay.
it doesn't change anything from what you're being billed. It doesn't change anything from what the therapist is billing out in therapy. And it might not even change what you're doing in your sessions.
Mhm.
It's just telling insurance, hey, look, I know that we're not making things a ton better, but we're
Okay.
dealing with a progressive disease here. And so it's still important that we do physical therapy.
Okay. Well, thank you for explaining that.
No problem.
Well, we are out of our time. I think we got all of our questions answered. So I just want to thank you so much, Amy, for your
Yeah, thank you so much
time.
for having me.